2/3 of employees are currently working remotely, at least part of the work week, as a result of the coronavirus pandemic. According to a new survey from Clutch, 44% say it's 5 or more days a week. Not having a commute is employees' favorite part of remote work. Employees also enjoy a more flexible schedule. Difficulty collaborating is employees' least favorite part of this remote work. About 27% say interruptions and distractions are a challenge of remote work. Zoom is set to roll out plans to improve security at its teleconferencing app. One of the biggest security issues facing Zoom is the surge in Zoom bombings. That's when uninvited attendees break into and disrupt meetings. According to ZDNet, the company has hired a firm that specializes in managing bug bounty programs, hackers who are looking for vulnerabilities. And over the past 2 weeks, Zoom has patched all known security flaws and deployed features to secure Zoom meetings. Big tech is getting involved in the fight against the coronavirus, working on a way to use our phones to track the outbreak. How will it work and what does it mean for your privacy? Liz McLaughlin explains.
Smartphones could soon be a tool in tracking the spread of COVID-19 as Google and Apple work together to enable digital contact tracing.
Contact tracing is a core public health function in the United States.
Traditionally, contact tracing is done manually. The labor-intensive process involves identifying those infected, finding out who they've been in contact with, and encouraging those people to isolate or get tested.
We do a lot of work getting patients in, whether it be phone calls or field visits.
Now, Google and Apple aim to make it easier. In May, they'll push new software to all Android and iOS devices, allowing Bluetooth signals to track if a phone's been in close proximity to someone who's infected.
And then it will warn anyone who was around you that they may have been exposed in the last 14 days.
The companies say its tools won't identify particular individuals, but would make it possible for health officials to contact them. This week, both Apple and Google assured governments would not be able to require its citizens to use the software. Users would have to opt in.
I think that they really need to convince people that they are doing the right thing here, and it's going to be tough.
For it to work, trust and wide adoption would be necessary, not to mention better access to testing.
In the U.S. right now, we're doing about 150,000 tests a day. So we're orders of magnitude away from where we need to be able to do something that comprehensive and that aggressive.
Ambitious efforts facing enormous challenges in the fight against COVID-19. Liz McLaughlin, NBC News.
Once the technology is available in May, health officials will still have to build an app to utilize it. To participate, users would likely need to download an app in addition to opting in to share location and proximity data. So how many people would need to buy in for it to work? One estimate from a contact tracing research group suggests that 60% of people in a region would need to download the app before digital tracing could stop the spread of the virus.